Hi, so tell us a little bit about who you are and what you had done.
Okay, I'm Michael Greer. I'm a 63-year-old construction executive, and I've had knee pain for about a year and a half, kind of brought on by some meniscus surgeries over my life, and then just really was declining in that, so I had my left knee arthroscopy done here.
Yep. And you are, how far out from surgery are you, Mike?
Let's see, it was a week ago yesterday that I had the surgery, so day nine.
And do you have any pain?
I have very, very little pain. And part of why I picked Dr. Gough and his procedure, he did a great job of describing what he did and why it was important to him. And I think he's delivered so far.
Awesome. And how are you walking?
I'm taking it pretty easy. We've got a little villa that we have, and I walk around that and really in and out of the car. And I use a walker still, but I feel like I have a pretty wide gait and don't feel too restricted. Got my bandages off today and feel like I'm just on the road to recovery.
And one last question, what advice would you give someone that's either like thinking about surgery, maybe a little scared, or doesn't know anything about the muscle sparing approach? What advice would you give them?
I think the thing that I did was I interviewed 4 different doctors and really listened to how they explained what they did, talked about their procedures and their successes, and really the recovery time. And that's what convinced me. I think doing a little bit of interviewing and understanding how the doctor feels about you as a patient and your recovery, that's really what did it for me.
Love it.